The pandemic has left Peru's last responders overwhelmed with bodies and grief, while healthcare workers are on the front lines fighting COVID-19. These funeral workers are also putting their lives at risk.
I just ask that God gives me the strength to continue and to help my colleagues who are risking infection, risking a lot for society.
Crying on the inside. You think you've come to terms with the work, but when you return the deceased's remains, it's as if they are my family.
When coronavirus hit, Peru seemed to do everything right. The first case was recorded on the 8th of March. A week later, with just 71 reported cases, Peru's president announced one of Latin America's first nationwide lockdowns, declared a state of emergency, closing its borders and calling on citizens to self-quarantine for 15 days. Martín Vizcarra's decisive action stood in stark contrast to his Brazilian counterpart, Jair Bolsonaro, who dismissed the threat of the virus and told his citizens to defy social distancing and state-ordered lockdowns. But after more than 2 months, Peru is behind only Brazil in both cases and deaths in the region.
There was an increase in cases that came to a peak in May, but now we're at a plateau. It indicates that the trend will be a gradual, slow decrease. This is when we all have to cooperate.
Vizcarra has blamed the extent of the outbreak on Peruvians defying restrictions. But here, more than a third of people live in crowded conditions. 70% of people live hand to mouth, and about half of households don't have a refrigerator. So work and daily shopping is essential. With signs saying, "I don't want to die," workers at several hospitals in Lima have protested against a lack of protective gear and medical supplies. From the capital to the Amazon, the pandemic has exposed a dangerously underfunded healthcare system.
We are in a state of total catastrophe. The health system has collapsed. Doctors and nurses and technicians in general are decimated.
The state of emergency has been extended until June 30, outlasting those in Spain, Italy and China. Peru's government action may have been by the book, but its historic lack of investment in social welfare and healthcare has fatally undermined its response. Liz Maddock, TRT World.